Hello everyone, my name is Eduardo Lamas, and in this video we're going to compare acute and chronic inflammation. Acute inflammation is a rapid response lasting hours to days to injury, characterized by erythema or redness, warmth, edema or swelling, pain, and loss of function. Triggers include infection, foreign bodies, toxins, immune reactions, and necrotic tissue. Inflammatory cells predominantly include neutrophils, basophils, eosinophils, and some macrophages, which are part of the innate immune response. In acute inflammation, the matrix is composed of necrotic debris and acute inflammatory cells. Chronic inflammation is a prolonged response lasting weeks or months, characterized by an interplay of inflammation, tissue injury, and efforts to repair the damage. Stimuli include viruses, chronic infections, persistent injury, and autoimmune disease. In chronic inflammation, the adaptive immune response plays a fundamental role. Inflammatory cells include lymphocytes, macrophages, and plasma cells. Matrix is composed of fibroblasts, fibrin, new vessels or angiogenesis, and chronic inflammatory cells. Acute inflammation can have several outcomes. Infarction, bacterial infection, trauma, and toxins can cause injury that leads to acute inflammation. Some characteristics of acute inflammation are vascular changes, limited tissue injury, and neutrophil recruitment. One of the possible outcomes of acute inflammation is resolution. Which is characterized by clearance of the harmful stimuli, clearance of inflammatory mediators and acute inflammatory cells, replacement of injured cells, and restoration of normal tissue function. Secondly, acute inflammation can lead to the formation of pus or an abscess, and this can in turn lead to healing, which is characterized by fibrosis. In fibrosis, there is thickening and scarring of connective tissue and collagen deposition. In addition, there is loss of function of the affected tissue. Acute inflammation can directly lead to fibrosis, bypassing pus formation. As previously seen, fibrosis includes thickening and scarring of connective tissue, collagen deposition, and loss of function. Finally, acute inflammation can progress to chronic inflammation. In chronic inflammation, there is angiogenesis, or formation of new blood vessels, mononuclear cell infiltrate, fibrosis or scarring of connective tissue, and progressive tissue injury. Chronic inflammation can in turn lead to healing, characterized by fibrosis. In addition, viral infections, chronic infections, persistent injury, or autoimmune diseases can cause tissue injury that leads to chronic inflammation. After watching this video, please rate it by using the thumb up or down option below. Thank you.